There we go. Okay. Hello, everybody. I hope you can hear me. Let's see, we're live. This is Dr. Magarelli, CNY Fertility. Welcome to our Tuesday. Hey, Jessica, good to see you for a good evening. And I am on Instagram. I'm going to do a very short presentation here. Hi, Amber. Hi, Amber. I'm going to do a short presentation here, and then I'm going to answer lots of questions. This is question evening. They're sending out the messages out to the Instagram folks. Hello, Mimi, Nicole, Melissa, Melinda, Kristen, Yersinia, Misty, Suzette, Misty, Lawrence County, Tennessee. Welcome. Glad you're here. Caitlin. Hello, Caitlin. Sage, Kirsten, Puffer. That's a lot of initials. KSKP. All right. Deshauna Brown. Hey, good to see you. Good to see you all. I know you see me, but I don't see you. So good to see your comments. Let me just jump the screen here. I think my screen jumped for a little bit here. Let's see if I can get it back here. Yeah, right there. Okay, so we're going to start there. I'm glad to see nobody's on Instagram because, quite frankly, we're doing much more on Facebook Live and YouTube because our StreamYard allows us to communicate with you guys. This is Jordan Bree. Hi from the Sunshine State. Lacey, hello. Janet, Danielle, welcome. Rachel, hi. Good to see you or connect with you. Ruby, hello. Hi, Ruby. I'm coming from the sunny state of Colorado Springs, or Colorado, in the city of Colorado Springs. And tonight, as I said, is going to be question and answers. Hi from Michigan. I spent some time at Michigan State as a professor there. That was a couple of cold, gray years. I started a conversation last week on the endometrium. So there were a couple of questions which I definitely wanted to get to from last week. Hell, from Virgin Islands. Wow, Shakila. It must be warm there, man. It must be warm there. I was just looking, United Airlines sent me a little notice which said $70 to any place at 70 degrees. So I'm thinking about it. I've been waiting for a live with questions and answers. Well, there you go, Amber. That's going to be today. So I'll tell you what, let me get the endometrium out of the way here. Hi, Indiana. And so last week we talked a lot about the endometrial thickness. We said that really any endometrium that's greater than 6 millimeters and above, the pregnancy rates are the same. So we tend not to worry too much about the thickness. But what we did learn last week was that the shape of the lining was really what mattered. But this was a question. Well, if I have RIF is recurrent implantation failures. If I have recurrent implantation failures, this was based on over 4,400 cycles. And what they found, if you're using frozen chromosomally normal embryos, if you have 2 in the freezer, then you have about a 70% chance of success on one of those. If you have 3 chromosomally normal embryos, you have a 95% chance of a clinical pregnancy, meaning an implantation. So it's rare that you can have implantation failures. And I'm glad to see those data. And the little arrows on the graphs there are just basically showing you that, and that's almost 100%, are successful as long as you have persistence and perseverance. And if you look up some of my old talks, I talk about persistence and perseverance. So a couple of folks asked me about the Receptiva DX assay. What the heck is that? Well, Bruce Lessig, actually, he's a fellow Duke University graduate. He's been studying the endometrium forever with integrins, and now with this oncogene that this, if you'll notice in the slide, let me see if I can get my little pointer over there. But in the slide here, you're going to see that there's two two tissues, and the one that has little red lines show the presence of the in-phase endometrium and the expression of the BCL6. So you don't see very much of it. But in those patients with endometriosis, you see a lot of it. So sometimes folks transfer beautiful chromosomally normal embryos and they don't stick. Well, it turns out that about 80 to 85% of them may have endometriosis undiagnosed. And with this assay, you can find out whether or not there is cryptic endometriosis. In other words, if you had implantation failure, one of the things Dr. Kilt stresses is let's do laparoscopy for endometriosis. Well, this test is pretty darn good for picking out those patients who could have endometriosis and therefore more likely to benefit from the surgery. And then they looked at the positive predictive value of this actual test. And what they found is that it could confirm endometriosis, or a positive predictive value of over 82%. So that means about 82% of the folks express this transcriptome, and you can use it to predict that they're going to have endometriosis, and therefore before you put your next embryo in there, get treated. Now there's two types of treatments, and both of them, it's interesting. One is surgical, of course, where you can cut out the endometriosis, knock it down, but the other is actually 2 to 3 months of Lupron as a treatment. So you could treat for up to 3 months with Lupron, which is a GnRH agonist, and it actually suppresses these markers, and these markers, when they're absent, have a much higher pregnancy rate than those who have these markers. So that's another possibility there, okay? Is it useful? Well, you can see in this graph here, the clinical pregnancy rates after either surgery or laparoscopy were much higher than those patients who were not treated with either surgery or laparoscopy. And the miscarriage rates were much, much lower, which is the third bar on the right. So the gray is those patients who are not treated. The pink and the green are those who were treated. So basically, you have the option at CNY Fertility here of getting this test to help predict. And if you are positive for this marker, you may want to be on about 3 months of GnRH. And I just happened to find this today. You're going to see this in the news. The new test is coming out for the vaginal microbiome. We've talked about the microbiome in our bodies, in terms of metabolism, but it turns out there is a microbiome in the vagina, and there are now studies which do suggest that this microbiome could have a negative effect on a pregnancy outcome. So they found that the diversity of the bacteria in the microbiome are quite different in those who get pregnant and those who don't. Now, we don't know how yet to treat them, but at least we know to identify it might be a problem. And then, of course, sometimes antibiotics can be used, and we have an antibiotic protocol to adjust that, or certainly beneficial probiotics. And again, there's a couple of more studies. And then that was it. I just wanted, I kind of wanted to do what I promised, which is bring up this whole issue of the endometrium. This is going to be recorded so you can add it to last month. So I'm here for you guys. There's a question by Diana about adenomyosis. Actually, I'm now doing another talk on adenomyosis for you guys. I'm doing all the literature search right now because I want to be contemporary. And adenomyosis can be managed also, interestingly enough, with 3 months of Lupron or a GnRH agonist as a way of improving it, or surgery. Now, in this country, we really don't do much surgery for adenomyosis because it's in the muscle of the uterus. Adenomyosis is absolutely associated with loss. Okay, Amber, I'm 29, tubal reversal is blocked. I was told that more likely tubal reversal failed on the right. My left tube is open and flowing beautifully. Conceived in December was either an early pregnancy loss or ectopic that was absorbed. Most of my had an analysis. Okay, you can't write paragraphs. I just can't, I can't read paragraphs. Ask a very small question. That's you, Amber. Miguel, what were those statistics again regarding normal chromosome embryos? Does age matter on these statistics? Yes. Normal chromosomes are found in embryos about 50% of the time in 20-year-olds, about 30% of the time you'll find normals in 30-year-olds, about 10% of the time in 40-year-olds. What are the BMI requirements for a tubal reversal? There are no requirements for BMI for tubal reversal, but Danielle, remember, it's sperm too. So just because you're going to have a tubal reversal, there's age-associated sperm. You need to find out what your AMH is. You need to find out if there's any male factor. There's about an 8% chance of success after tubal reversal, so that's in a 20-year-old. What protocol do you suggest with there's no protocols for block tubes or morphology. IVF, the protocol that people talk about, and I did a lot of talks on this, are really simply adding hormone to grow eggs. There's no fancy schmancy anything else. Do you have enough hormone to grow the eggs that you have available? In your 20s, you have about 1,000 eggs a month available, of which about 100 are receptive. In your 30, you probably have 50, and of which maybe 15 are receptive. In your 40, you may have, a couple of hundred, of which maybe 8 are receptive. My consult with your clinic is May 3rd. I do have endometriosis, so can I get prescribed Lupron earlier so we don't wait? No, Sophie, you have to be a patient. So first be a patient and then go forward, but see if you can move your appointment up. Thanks for popping in and saying hi today during my transfer, Danielle. I'm sorry, I know I popped in and I apologize, but yes, stick, baby, stick. I'm coming to you this month. Do I need a COVID-19 test? Amanda, if you're coming to me in Colorado, you do not need it. You only need a COVID test in New York for procedures, not to go see someone. Do you recommend HCG wash, Amber? Yes, because what it does is it primes your uterus into thinking, hey, I better get all of these things receptive for pregnancy. What protocol do you suggest for failed implantation? This is Lee. Well, Lee, depending on the reasons for failure, if they're chromosomally normal embryos, then we might want to look at it for endometriosis. If it's untested, then it may simply be that. Hi, Sarah. I'm glad. Well, fingers crossed on your transfer yesterday. Allison, have you ever had success with azospermia using ICSI? Okay. Azospermia, Allison, means no sperm. So, and ICSI. So if the reason for azospermia, no sperm, that's all it means, without sperm, is because the husband never makes sperm, then of course there's nothing we could do but donor sperm. But if the reason is simply a blockage or there's very few, you can go directly to the testicles, do a sampling of the testicles by PISA, MESA, or TESA, PESA, MESA, and then get the sperm, and then do ICSI, absolutely. Can I use Avidril for an HCG wash? Well, HCG is Avidril, Avidril is HCG. Amber, I take Maca Root, Ovaboost, B complex, and prenatals, CoQ10, I'm assuming. Something, yes. Yes, please, I don't recommend Maca because I don't know anything about it, but do read and download our family building guide, because that family building guide has everything you need there, and the molecular fertility medications are there. How long should I wait to do IVF if I just had laparoscopy? 2 months. Allison, yes, TISA. Should I test for recurrent pregnancy loss if I got a removal of a fibroid? Should I assume it was because of the fibroid? Probably the fibroid is the reason. Carolina, but again, it's just a blood test for recurrent pregnancy loss, so there's no downside. Do you recommend ERA for endometriosis patients? Well, Jordan, I just did a talk last week on ERA. It only helps about 18% of our couples, so it's rare that you may need that, but usually these are couples who have failed. You can do it prophylactically, but the data doesn't seem to be strong that you should. I want to change going to Syracuse to come to Colorado, Caitlin. Is that possible? Absolutely. We're all one family here. People come from me to there to here. Absolutely. If you guys want to come out to Colorado and see our beautiful mountains, we're here. Hi from North Carolina. Hello. 2 failed transfer, untested embryos. Transferring my last embryo. Do you suggest HCG boosters? Yes. And you do immune protocol 3, and you can look that up in the family building guide. Heather, I may call the Colorado facility. You seem great, but is the Atlanta facility doing IVF? Heather, no. Atlanta currently does not do, it does monitoring and IUIs, but it does not do retrievals or transfers. Dr. Verdialis has actually been up in training in Syracuse to learn how. We're moving forward with setting up Atlanta, but I don't know when that's going to happen. Is mini IVF available after partial hysterectomy? Now, that means you don't have a uterus when you say a hysterectomy. So you may have to, Misty, explain that to me. Does HCG help with implantation? Yes. Also, my progesterone was 2.6 when I experienced my loss. So Amber, absolutely. You want to have progesterone supplementation, both intramuscular as well as vaginally. My daughter usually is on my talks, but she's not going to make it tonight. But when the place the embryo in the uterus, is the embryo already implanted a tad bit? No, this is a great question. This is a safe place for questions. We want you to ask questions, Amber. Everybody. It is free floating for at least 24 to 48 hours. Again, look at last week's broadcast because I talked a lot about when things implant. Natural killer cells can be the cause of recurrent pregnancy. Okay, that's not a question. Wanting to create embryos to transfer to a gestational carrier. Absolutely. If you have your ovaries, Misty, we can get, well, if you have eggs, of course, and I don't know enough about your history, but if we get the eggs and make the embryos, absolutely, we can transfer those into a gestational carrier, and we do it all the time. Do you think MTHFR could cause recurrent implantation failure if laparoscopy was negative, right? Reiki, absolutely. If you have the gene defect for MTHFR, which just means that your folic acid metabolism isn't either efficient or deficient, then taking supplemental folic acid at least 1 milligram is really something that you should be doing, and even higher. Methylated folic acid or methylated folate. My wife is 40 years old, failed transfers on PGS normal tested embryo, also did ERA. Will protocol stay the same or will something change? It is impossible, Miguel, for me to give you an answer to that. Gretchen, is mini IVF InvoCell? No. Mini IVF is a medical protocol. InvoCell is a piece of equipment. What do you think of the results of the receptivity? Again, I know the doctor who invented it, Dr. Leslie, I actually went to school with him, a very smart guy, working very hard. I think it has a place, but the place is very, very small in our armamentarium. Is a chemical pregnancy considered a fail? What do you recommend after a chemical? Well, Lee, no, it's not a failure because you've had implantation. So it depends on what your treatments were before. There's no, just because, okay, put it a different way. 70% of 20-year-olds who get pregnant miscarry, and only 15% of them know it. The other, 55% will say, oh, my breast hurt, I had a late period or it was a heavy period, but honestly, 70% of most pregnancies end in miscarriages. And so your likelihood as we get older of having a successful pregnancy is low. And the reason I'm saying that is so that we trust nature to figure out how to do this. I have Hashimoto's and you should be on med. Will I do an immune protocol level 3 or 4? It has nothing to do with Hashimoto's, Kelly. You should be on medications for low dose thyroid medicine. What's the procedure that's done during transfer that can help with implantation? There is no procedure to help with him. What is that guy? He is the guy who created the octuplets, Octomom. But jamming the catheter below the surface of the endometrium, which was never proven, no one does that. No luck in 17 months. I don't have a consult until May, so no blood work until after that. What do you recommend besides a prenatal? Absolutely, Ashley. Go to our website, cnyfertility.com, patient resources page. Download our family building guide, which is beautiful. I just saw the new version of it. It is beautiful. Download it. And you have a million things: acupuncture, serovital, vitamins, keto approach, Kiltz's keto. Vernalin, I'm thinking of doing IVF. Do you recommend a COVID vaccine for everyone? If you're pregnant, take the vaccine. If you're breastfeeding, take the vaccine. If you want to get pregnant, take the vaccine. But make sure you tell us you're taking the vaccine. Well, Kelly, when you're ready to see a reproductive endocrinologist for your pregnancy, they'll tell you differently than your OBGYN. They're just different. Ronnie, well, I should say, we treat Hashimoto's for fertility. You don't need to treat Hashimoto's for a female, you need it for a fertile female. Ronnie, undetermined infertility and had 2 failed transfer, have a hysterectomy and laparoscopy scheduled. Anything else I should do to see what, not a hysterectomy, a hysteroscopy. You scared me there. You scared me there. And with these PGT tested embryos, Ronnie, Jennifer, what is the ideal thickness? Please read and go through. This is Jennifer Gallo. Look at last week's live that I did, as well as the first slide today, and basically anything over 6 millimeters. Amanda, failed 4. Will I be allowed to transfer 2 embryos? Yes, if they're untested. I'm going to say hi to Dr. Kills here. Hello, Dr. Kills. I'm on live here. Say hi to everybody.
Hi, everyone. Dr. K, how's everyone doing?
They're all doing great. They're on live here, but they can't answer you back. Do you want me to call you? I love you. Bye-bye. Bye. All right, that was Dr. Kills. All right, the endo scratch recommended to add to an FET cycle. And I also talked about that. There's really no data to say that that helps anything. I'm 40, my husband's 33. I've done 3 IUIs. You need to do IVF about years ago. So after age 35, Kelly says hi. After age 35, IUIs and sex are the same. So if you're doing IUIs after age 35, it's not wrong, but the data doesn't seem to say that you have any better chance than having sex, so have sex. How can Neupogen and intralipids help with recurrent implantation failure? Well, the whole thing about that, Reiki, is to reduce inflammation and counteract the body's rejection of the implanting embryo. So that's the principle. And if you go to our family building guide, again, guys, CNY fertility, it's all there. Any tips to help implantation? Acupuncture, the vitamins that we put you on, reducing alcohol, tobacco, drugs, doing PGTA on your embryos. This is you, Jordan. Will polyp removal help implantation? Oh my gosh, absolutely, Rachel. That could be the reason why you didn't have implantation. So absolutely. Would you recommend doing another retrieval to get 5-day embryos to PGT test them? Time to conception over 10 years. You're 36. Yes, Nicole, you have to try to figure out what is it that's in the combination of the sperm and the egg. You know, it's either 50%, we don't know, and 50% it's either a mechanical reason why you're having repeated failures, or it's genetic. So really easy-ish to figure out. Jordan, Bree, please go to our family building guide. All of the vitamins are listed there. 2 to 3 day frozen embryos, Nicole. I don't have a question, sorry. I am a 32-year-old male who uses cannabis. Don't do it. I have a 10-year-old daughter from a previous relationship. If I would need to stop, yes, stop the cannabis, stop alcohol, Losamia, stop alcohol, tobacco, street drugs, you know, really. Really? Okay. What is the reason I might have had that small blood cut on my cervix when you did my HCG wash? Kaylin, that's a personal question. We'll have to do that some other time. When Lee blog Katie, I do not recommend endometrial scratching. It is, if it's what I saw in the guide, the prenatal is like $120. Actually, that I don't know what the price is. You'll have to be a little more specific there. When is frozen transfers recommended? Well, if you have ovarian hyperstimulation, if you have multiple eggs so that you have a very high estrogen or you have PCOS, frozen embryo transfers actually are very beneficial. Does having a low BMI have a higher success for implantation? Absolutely not, Leslie. Lazia. No. Extra low BMIs, extra high BMIs, those have lower implantation. Kelly, I'm having my husband's semen analysis done in April after my consult. I plan to do HSG. Do I need the other one too? I forget what it's called. Say a saline histogram. Yes, do both. And do have your husband do your semen analysis well before the meeting, because that may be the issue. Heather, no alcohol at all or cut back. I have a glass of wine once or twice a week. Once or twice a week, and a glass of wine is 4 ounces. Sure, but again, alcohol, tobacco, and drugs, and again, moderation in those circumstances are not necessarily a good thing, because, I mean, moderation is a good thing because, quite frankly, they are toxins. That's why our brain loves them, and they give us a response. Hi, Nicole. I was just saying I have 2 3-day embryos in Buffalo. Might do another retrieval to try to get a 5-day embryo and test this time. Yes, I have 2 3. Well, I might do a retrieval to get, yeah, well, you might just ask them you could ask them to grow out the other embryos and have them tested too, along with your other ones. Amber, anytime you have questions, please call our 800 number. And then depending on where you're seeing and how you're seeing, just tell them either you need a clinical question or a financial question, just ask. Absolutely, Kelly, COVID vaccine for everyone while you're stimming, before you're stimming, when you're pregnant, when you're breastfeeding, please get the COVID vaccine. Can egg retrieval outcomes change based on diet supplements? Well, anytime you're deficient, you're going to have a lower chance of implantation. So again, healthy body is a fertile body. The more we provide support to the body to be able to manufacture the proteins, the enzymes, the triggers, the immunoglobulins for us to function at our peak. That's the whole idea behind Kiltz's approach to diet and spirituality and the fertile secret. It's all about putting it all together, okay? And again, I coined the term healthy body is a fertile body because I really mean that. I can't, Samantha, go back. I have 1,000 people asking me questions, so I apologize, Samantha. I don't know what you asked before. Yes, it's my first consult. I was told I got to wait, and that's why I just asked Dan. I go through CNY for those. Yes, you can go through the testing as long as you have, sorry, Kelly, I misunderstood. If you have a consult schedule, then yes, the testing can be all you do is call that number and say, listen, I'd like to get whatever, the basic testing, and we call it preconception testing. And I would contact them and say, that's what you'd like to do, and have your doctor do. I turned 30 this year, so my eggs are still at good amount, or is it more like, no, your eggs are fine, Amber. That's a great age. First was tested, second was an undetermined infertility and had 2 failed, have a hysteroscopy schedule. Anything else I should do to see what's wrong? No, Ronnie, you've probably done the preliminary testing, your blood work, your thyroid, your prolactin, your CBC, check for anemia, check your liver, check your kidney, check the sperm, check the egg, AMH. Woohoo! Okay, Kelly, hugs back to you. Reiki, do you prefer a thyroid medication best for Hashimoto's? Well, I happen to like Armor Thyroid or NP Thyroid or Nature Thyroid, but Synthroid, Levothyroxine, they all work. Samantha, I know my issue is PCOS. Where do you recommend I start? Well, the Kiltz's keto diet for sure. That's the best place to start. Acupuncture. And if you live close by to any of our centers, we have healing arts centers. In Colorado, we use East Winds Acupuncture. That's eastwindsacupuncture.com. The healing arts, you can find them on our website. And if you still don't have anyone close by you, you can contact the American Board of Oriental Reproductive Medicine, www.aborm.org. There you go. Does being anemic impact not getting pregnant? Well, Ronnie, the key thing is you want to make sure you're not anemic when you're carrying, because that is associated with losses and also problems with the pregnancy. So managing your health has got to be your kind of priority. Now, anybody have any other kinds of questions, sort of more general questions that I can, what's the success rate with fresh IVF, or is IVF in general being, well, the success rate with fresh IVF is about 30% for a 30-year-old. You're welcome, Samantha. You know what? I forgot my water. That's all right. All right. No water. Okay. Any other questions, guys? It's slow with the questions today. FYI to the ladies asking about semen analysis, my OBGYN was able to order my husband's. Yes. Yes. We love that. Yes. Thank you, Karina. Appreciate that. And yeah, folks, help each other. Really help each other. That's always a good thing. Let me see with my Instagram following here. Let's see. Oh, there we go. I'm back here. We'll start me live again. Okay. Can you talk about your goal follicle number? My goal follicle number. I'm not sure. I don't know what that means. I'm almost 36, 3 failed IUI. During our retrieval this month, I have PCOS and endo. Tests are coming back fairly normal. What's the average with endo and PCOS? Well, it's really your age that determines your success. So for 35, if everything else is normal, it's about a 15 to 20% chance of success. Pretty much. Is IUI or natural recommended for recurrent implantation failures? Anything is recommended, but mainly then I would do the immune protocols, the antihistamine protocols, the antibiotic protocols. I would do acupuncture, etc. I am 14 weeks pregnant. Congratulations. What should I do with my extra stim meds that expire in September? I don't know. You can call Alma, call the clinic and see if you can donate them. Do day 5 embryos have higher success compared to day 6 or 7? Not necessarily, Shelby. There was a time where we thought if they were a little slow that there was a problem, but nope. Kaylin, I have my beta tomorrow. I'm spotting a little. That may be a good sign. It may be implantation. But keep yourself hydrated. Take your progesterone. Take your baby aspirin. And honestly, just have the faith. We see spotting all the time. Does CYN happen to have a list of monitoring clinics out of Colorado? Yes. There's a web page, right? There's a page on our web which says affiliate or satellite clinics. And of course, you can always just simply call us. Do you recommend the Zymot kit to help select the best sperm? I do not. Does bruising on baby aspirin affect how much Lovenox to be put on? No, I don't think so. What causes ovarian hyperstimulation syndrome, Amber? Too many eggs, too much medicine. Thank you, Jessica. You're so wonderful. Go to the travel section of CNY. There's a list of clinics. You're just wonderful, Jessica. Amber, if I have a successful fresh transfer and a failed in December, would you recommend testing or another FET before additional testing? Oh my gosh, definitely testing, my dear. I mean, unless, I'm assuming you got retested in December. If you hadn't been retested in December, then no. Clone would work for me my first time. Will it work again? Well, Kelsey, you're asking me to tell you the future. I don't know. I hope so. Any specific supplements to take to better prepare for what is donor embryo? No, there's no specific ones, Leslie. just go to our CNY fertility page. Thank you, Sophia, for the website. Y'all all the best. Thank you, Kaylin. Brittany, I have anovulation. Tried Clomid, worked a couple of times and stopped. Doctor wanted to put me on birth control for 3 months, then start Clomid again. Well, that is an interesting protocol, but yes, you should stop after 3 months of Clomid, take a break, then come back on. Lashana, they recommended that I get off my Prograf because of my second vaccine. Yeah, we don't know the interaction, so that's a safety thing, just simply safety. Can I request a Zoom meeting with me? Absolutely, Caitlin. I love Zoom meetings. As I told you last week, just request it, and even if you don't have it, we can hook you up when I get on the phone. 38, HSG showed blocked tubes on both sides. Can this cause issue? Well, okay. So Arena, blocked tubes will prevent the egg from coming into the uterus, so you need IVF. So the tubes themselves should not cause problems with implantation. You're welcome, Reiki. Macaroop helps. Oh, yeah. Well, we don't know that, Amber. Someone suggested that. I haven't done a deep dive in there, and since I usually only talk about the things I feel really confident about, then I kind of don't make comments on it. If I don't know, I don't use. I have PCOS and blocked left tube. AMH, I was told to have laparoscopy to unblock the tube, and I have an appointment with CNY in May. My AMH is 0.5. Shannon, I would seriously consider doing IVF and not unblock your tube because your AMH is low ovarian reserve, poor ovarian reserve. So I would seriously consider having another discussion about poor ovarian reserve. I don't know how old you are, but I would. My daughter wants to do IVF. Her husband has low motility and morphology, but her husband has great sperm count. Well, Jill, in order for sperm to work, the count has to be good, the motility has to be good, the morphology has to be good. One doesn't offset the other, so it's critical that you understand that. And now, I don't know how young is, but even in a 20-year-old, if you have a motility issue and a shape of the sperm issue, even with a great count, your pregnancy rates are less than 5% with sex, of course. So if I can't do that. TYS, I'm 36, Shannon. Forgot definitely you want to consider IVF, Shannon. Because your chance with tubal reversal working at age 36, you'll probably have a 1, 2, or 3% chance of getting pregnant each month. With IVF, you'll probably have somewhere between a 25 and 30%. And if you do IVF with chromosomal testing, you'll get somewhere between a 50 and 70%. So depending on which percent feels good to you, that's going to determine what's your best route, okay? Honestly, that's really going to determine your best route. What can be discovered during hysteroscopy and laparoscopy, Ronnie? Everything. Whether your uterus is normal, meaning there are polyps or there's scar tissue, that's the hysteroscopy part. Whether there's something blocking your tube, you can see that sometimes on the inside. Laparoscopy is going to tell you whether you have endometriosis, scar tissue, whether your tubes are open or not. So there's lots of great information that you can find out. Can somebody say hi? It looks like the questions are not still streaming here. Just say hi. Any further questions here? Hello, can you guys still see me? Am I still live here? Okay, there you go. Hi, Ronnie. Hi. Thank you. My husband has a morphology program too, but good motility. Well, that's even worse, Shannon. Hi. Everybody's back. Hi. Thank you. I thought you all went to sleep, and I was like, where is everybody? With zero morphology, a sperm count of 28, shouldn't it be a good sperm seen with ICSI? Shouldn't there be good sperm seen? Well, that's my point, Amber. I see the question. So, the nice thing about ICSI is it doesn't matter the shape of the sperm, it just matters whether the sperm are alive or not. So that's the good news, right? Because then even if you have 0 normal sperm, you still can be a daddy. So you recommend testing our day 3 embryos with the last transfer failure. Nicole, what I'm recommending is if you're going to do another cycle, ask them if they'll grow the other ones and also test those. That's just a question. What can cause a polyp on the cervix? Being a woman, Lashana. That just happened. They simply just happen. There's no like, this causes that or that causes this. Samantha, we are getting ready to start a stim cycle. How do we know what medication protocol is best? If you're getting ready to start a stim cycle, you should have already gotten your protocol. And that would have been the best that the doctor felt for you. Why would someone have a back-to-back egg retrieval and have less eggs a second? Absolutely. Oh, well, Anna, the theory, Anna, is that when you do a back-to-back cycle means when you have a one cycle, the medicine can help the second, third, and fourth cycle. It can, but it doesn't have to, because each cycle a woman has is independent of the other. But if you enrich, let's call it the soil where the follicles live, with these hormones, we have seen, not in all cases, increased numbers of eggs. Can weight be a major factor in fertility on both sides? Absolutely, Sarah, absolutely. That affects both female and male factor. The lining is trilamina for FET is important or not? Absolutely important. And again, go back to last week's broadcast. We're going to the Colorado location. No one has contacted us, Samantha. Well, who gave you the protocol? I can't say that. Just call tomorrow and tell them you don't have a protocol. Are there any drugs to help besides aspirin? Oh my gosh, yes. If you go to our family building guide, and you, depending on what immune protocol, usually most IVF patients are immune protocol 2, but some are on 3 and 4, and there's lots of different medicines. Could multiple weight loss abdominal surgeries cause scar tissues on the uterus? No, Ronnie. I don't know anything about CBD oil, so I really can't comment on it, Reiki. I'm not, again, like Maka, this is not something I feel like I'm an expert in. So I'm kind of a purist, kind of an egghead kind of guy. So I usually talk about what I know. Sorry, everybody's calling me today. Is there a substitute for LDN if I can't take it? You don't have to take it, Reiki. So what do we have there? Oh, that's interesting. What's CoQ10 do? Well, it's an antioxidant. It's a very good antioxidant. And oxidation is a problem. Think of oxidation as like rusting. That's oxidation, but it can cause havoc with sperm, eggs, uterus, implantation sites, your vessels. So by enhancing your body with antioxidants, you're going to improve your outcome. That's that simple. A few weeks ago, you mentioned that one twin may be absorbed by the other. In what week of pregnancy does that typically happen? Don't know. I don't know what typical is for, it's not absorbed by the other one, it's just simply absorbed within the placenta. Okay. Can you send it to me via message? Okay, that's Amber. Okay. You guys are talking to each other, which is great, because that's the purpose of this. By the way, I'm Dr. Magarelli, CNY Fertility Colorado, in Colorado Springs, part of the big family of amazing people in New York, in Canada, soon Florida, Atlanta, Colorado. Got lots and lots of peoples. People. I don't have my water, so I'm losing my ability to speak here. Okay. Any other medical questions that I can help you guys with? So what do I know? Well, Dr. Fink is here on Monday, so I'm excited about him coming back up. Can you pick out the good sperm for IVF? Well, Jill, it turns out that the sperm that your husband makes, the DNA is all we need. So whether or not they're morphologically good or they swim bad, it doesn't matter. It's really the DNA inside the sperm head that will allow that embryo to be made successfully. So the great thing, yeah, we love Veronica and Melissa too. The great thing is that even if the man makes no normally shaped sperm, he can still be a dad. Do you know the long-term effects of fertility drugs? They don't have long-term effects because they tend to last less than a day. In my clinic, they give option either to have a trigger shot or not with an IUI treatment. Which one is the better option? Trigger, absolutely. You're paying for it. In other words, you're paying for precise treatment to reduce variable, and the biggest variable is ovulation. So why wouldn't you want to know precisely when you're ovulating? Absolutely do it. What is a good anti-inflammatory med to start before FET? CoQ10. Anything to start ahead of time in addition to keto? Yes. Go, Amber, to our family building guide. I think I'm going to put that on here. Go to the family building guide. Retrieval cycle was canceled 2 weeks ago due to low E2 and little to no follicle growth. Menses hasn't arrived yet. At what point do I worry about no period? You said 2 weeks. Contact the clinic. Get them to get you to come in and start your period. Okay, that's we do that with progesterone. If you have a failed transfer, me Hutchins, should you wait for the next cycle or give it a few months? No, next cycle. Let's get going. Is trigger used for a natural cycle? Yes. Could my really heavy periods be a sign, Sarah, of possible infertility? Periods have been like this since 10. No. I'm being very specific because if it's been the same, then there's probably something else going on. I'm Caitlin. I'm 34 with 2 healthy kids. Then ectopics. Should we test our embryos? 34. It's not a matter of should. I wouldn't necessarily recommend it if you get a lot of embryos and or a few embryos. I wouldn't recommend it. Some folks in the past felt that it was good for everybody. We do feel that it increases your or shortens the time do you get pregnant because you know that you have chromosomally normal embryos. And because that will shorten the time because you can't tell a good or bad embryo from what it looks like. Amber, what's the difference in natural and meds? Is ICSI still used with natural? I'm not sure what you're calling natural. You're talking about, Amber, a natural start with fertility medicines or no fertility medicines. But ICSI is a process for the sperm, not for getting eggs. So the answer is you can do ICSI, and you might want to do ICSI because you only have one shot at it. Are there different types of PGS testing? What is the gold standard? It's it's next generation sequencing, NGS, and it's PGTA I'm talking about. But yes, everyone today is using next generation sequencing. So you don't have to worry about the quality of the testing. Is trigger a medicine? Reiki? Yes, a trigger, meaning we're triggering pre-ovulation with HCG, human chorionic gonadotropin, or if you're on a citrotide cycle, you can trigger with Lupron. Lupron is safer. How is Clomid used in IVF cycles? Very rarely, Nicole, very rarely. As a matter of fact, I never do. And the last time I remember seeing it done was 1982. So don't know very much about that. And if you meant how is it a trigger of medicine, yes, and it is a shot. Everything we tend to give is injections. Everything we give is injections. So are you doing IUI Reiki? Yeah, so please ask. Yeah, so again, I don't know enough about your cycle, but yeah, please ask. Is letrozole or Clomid is better? I like letrozole because it causes what's called monofollicular development. It doesn't stick in your body for 6 weeks like the chemical Clomid does. It has fewer side effects. As a matter, it has no visual side effects, which is another reason I like it. It's an aromatase blocker rather than a receptor blocker, so I think it's gentler. What are the specific studies around exercise negative impact on IVF, Erica? So do you have a study? I don't think I've ever said that exercise has a negative impact on IVF. Thoughts on transferring 2 embryos, Ariana. How old are you, Ariana? You know, and are they tested? If you're over 30, maybe 2 is okay. But if they're tested, we really like, which means chromosomally tested, we really like you to just do 1 at a time, because we've put in 1 and certainly gotten 3, and many people have put in 2 and gotten 8, which is a lot of babies. That's a lot of babies. You're welcome, Carm. Happy to oblige. Okay, let me talk about exercise. Any kind of exercise is movement is good. Movement is good. So the bottom line is, we like to call it exercise, but it's really movement and moving. That's what it is. And so excessive moving or excessive eating or excessive smoking or drinking or whatever, those are never good. My wife is a competitive triathlete, so she trains 20 to 30 hours a week and is tuned to that. She's not trying to reproduce, of course. And there are many people who are athletic, but in my mind, you want to put all of your energy into your body, and yes, it can increase intra-abdominal temperatures when you exercise excessively, and that's a little cooker. And if it's too high, it can't be good. So reasonable, swimming is great because you don't overheat. Atraumatic type workouts. But it's too general. There's probably 1 million books written on exercise, the types of exercise for pregnancy, Erica. What causes a biochemical pregnancy? It's the opposite. A biochemical pregnancy is a description. It is not a thing. We're just describing the fact that you had an HCG, which is the pregnancy hormone, go up, but we saw no pregnancy. So that's why we call it biochemical, because the only indication that you're pregnant was a pregnancy test that was positive. That's all it means. It's a description. It's not a thing. It's not like a disease. I'm 38, no testing yet. I'm still priming. I had no idea one egg could become 3 babies. Yes, ma'am. And I've seen it. Amber, I've heard about the keto diet, but what if I'm a small eater? I only eat 1 time a day and snack. I'm 103 pounds and don't want to lose weight. In your case, you want to have a low carb or moderate protein, high fat. Just increase your fat. Is it true that Colorado isn't doing PRP yet and have to go to New York? Absolutely false, Erica. Erica, who told you that? That is it's a fib. We've been doing PRP. We've been doing everything. So Erica, tell the world we're doing PRP in the ovary, in the uterus, everywhere. No, you don't have to go anywhere. Okay. My mom and sister are autoimmune nightmares. Is there anything I should do just in case? I also have one. They have to get everything diagnosed. I do not. What? They have to get everything diagnosed. I do not. Caitlin, not sure your question, but if it runs in the family, definitely be pre-tested. Erica, you're very welcome. What's the cost of IVF, Danny? Please go on our website, www.cnyfertility. And believe me, all the details are there about our basic IVF is 39 something. Our IVF with chromosome testing is around 7,000. So it's about, well, for example, in Colorado, if you go to Denver, you're going to spend between $36,000 and $45,000 for each IVF cycle with chromosomal testing. At our CNY Colorado Springs office, you're going to spend about $7,000. You can imagine they're not happy with us. Would you mind explaining ovarian drilling to help people with no? Do not damage the ovary if you have low ovarian reserve, because all of the eggs are around the edge of the ovary. And if you're going to burn and kill eggs, that's what you're doing. You're killing follicles when you do ovarian drilling. So you don't do that for diminished ovarian reserve. It's the opposite. Leave them alone, in my opinion. Does the med use prevent ovulation for all? I don't want to ovulate on my own and miss anything. I'm not sure what you're asking, Amber. Not sure. Can egg be retrieved without gonal F? Well, the gonal F is not chosen low. The gonal F allows you to save eggs. Every month, if you're less than 35 years of age, you lose 1,000 eggs a month. So what the gonal F does is it saves your eggs. So you want gonal F to save eggs. And if you're over 35 years of age, you're losing 10,000 eggs a month because your body can't make enough gonal F or follicle stimulating hormone. So you absolutely want to get as many eggs as possible to be successful. Yeah, Leslie, the average in Washington, I guess, was 40,000. We charge 7. That's well for the top of the line, of course. And then you have to buy meds like everybody else and anesthesia. But look at our website. Is it okay to use Follistim instead of gonal F? Absolutely, Jenny. Jenny, those are the same drug. As a matter of fact, the Follistim people have to pay the gonal F people for patenting for the patent. Hi, Dr. M. Would you ever administer an IVF medication protocol for an IUI? Well, the Erica. So that's called IUI with injectable medicine. Yes, IUI with injectable medicine. I think that's what you're asking. Yeah, we do that all the time. If you have a short natural LH surge, should you still wait 36 hours? Yes, after a trigger. Yes, because you're no longer natural if you're using a trigger. That's the whole point of why you want to be on all these meds. Hi, La Medina. Thank you for joining me. Jump from Instagram over to Facebook. We're kind of all focusing on Facebook. So La Medina, jump over to CNY Fertility Facebook. Okay. I do not talk about financial, Danny. So there you go. Tia answered your question. Okay. Yeah, I just don't like to talk about financial. If you have a short natural, we answered that. Yes, you give yourself your own triggers. Yeah, it's we do telehealth for $50. I think that's right, Jessica. I think the average in Denver is $300. I think it used to be. I don't know what it is now. Why are both Follistim and gonal F listed on people's protocol if you can use another to replace the other? They're not. They should never have Follistim and gonal F on their protocols. They should not. They should have one or the other. Now, they may have Menopur and gonal F or HCG-LH and gonal F, but nope, you shouldn't have, unless you ran out of medicine, they're interchangeable, okay? Wow, today has gone by pretty quickly. Holy mackerel, it's almost 5:30 here. Well, let's see. I'm working on adenomyosis. I'm looking at that. I've done a talk, I think I've done a talk on vitamins and nutraceuticals in the past. Menopur, by the way, is just is a different type of fertility medicine than the gonal F or Follistim, and they both are used when you're managing patients. So yes, that just happens to be another one. So throw out some ideas. Let me write down some, guys, give me some ideas for next week. Next week we'll have a topic to discuss. So I've had some in the past. Yeah, why don't you guys throw out some ideas that you'd like me to talk about, and I can write them down. All righty, let's see. Male factor has been one. Supplements with Asherman's. So what caused the baby to stop growing after implantation? Too many things to answer quickly. How do you out-of-state people do their monitoring? We work with your local doc. Give me some ideas, guys. We're almost out of time here. Autoimmune issues. Oh, I hate that topic. It's so hard. I'll work on that one. Any other issues you want to talk about? That's the autoimmune. But I mean, anything. Come on, guys. Oh, adenomyosis. Yes, I am going to do. I'm working on that right now, as a matter of fact, adenomyosis. Anything else? Donor egg, sperm, and embryo IVF. Okay, that's a nice one. Donor egg, sperm. Okay, so third-party reproduction. Let me call it third party. I like that one. Side effects of meds. Oh, that's a good one. I should do that. I should update that. Male factor immune issues. We already got that. Male factor. Okay. Local doctor can do ultrasounds? Absolutely. Donor egg. Yep. Okay, Amber, that's great. Age factor. No, I've already done that one, but I'll take a look at it. If you go back, donor eggs, of course, third party. All right. Well, I think I got my marching orders here. Thank you again for joining me. It's been a lovely, lovely evening with you. I'm Dr. Magarelli, CNY Fertility, Colorado, but we're part of the big family. I talk to everybody, and everybody talks to my patients. We're here to help you. We have Dr. Fink coming on. We've just opened up another 6,000 square feet. So definitely, we've got space now. Thank you. We do all of the procedures we do. Thank you, Ronnie. Send kisses, everybody. Kiss, kiss, kiss. And then I will see you guys next week. Excited. I think life is good. I think we're safe. I'm happy. I hope you're happy. Everybody, please, I do recommend strongly that you do the COVID vaccine. Am I moving the mail collection room? Absolutely not. It's even safer now because there's nobody upstairs. Yeah, we got 12,000 square feet, 6,000 on the bottom, 6,000 on the top. See you next week, everybody. Have a great day. Bye.